Good evening, everyone. Welcome, viewers far and wide. We are so excited to have you tuning in tonight. Usually, we have the beautiful Grace Thorne hosting, but tonight I will be filling in for her. We have an incredible featured guest tonight. So, welcome, everyone. I want to hear where you're tuning in from. Please type in the chat where you're tuning in from. Would love to hear how far we are reaching tonight. And tonight is for education purposes only. As always, this is not medical advice. It is purely education. So sit back, get your pens and papers out, and get ready for one of the most exciting Carnosine conversations. Tonight is just not about aging better. It's not about fighting aging, but supporting the body so that we can move, recover, and truly feel good after 50. So those of you who are 40, 50 plus, this is for you. Those of you who are still young and youthful, this is also for you. So tonight we're going to play a quick intro. So I'm going to cue the introduction for our incredible featured guest this evening. The incredible Dr. Willie Villarreal. So excited to have you to the show. He's an incredible real life functional medicine practitioner who works with people every day. He is fit, he is healthy, and he has an amazing presentation to share with you guys tonight. Dr. Willie, when people come into your clinic after 50, what are some of the things that they're really struggling with, and what do you share with them on what to do?
Well, thanks for having me again. It was a great weekend. It's good to see you again. The majority of the people that are coming in are over 50, over 40, 50. They're all going to have the same issues. They're all going to have fatigue. They're all going to have joint pain, even if they're very active. It's a different type of joint pain. It may not be an injury. It might be just, an itis, right? Some kind of inflammation of. After 50, I will tell you, you can literally go to bed and wake up hurt and wonder if somebody beat you up in the middle of the night or, one of the amazing things that we've been seeing is that, the Lactigo has been helping, at first we thought it was just going to be isolated to athletes, right? Because that's what the majority of the research and the use has been for. But honestly, the majority of the patients are just your average 50-plus-year-old that suffers from all the same things: the fatigue, the brain fog, the joint pain, some type of injury or inflammation. Inflammation is a huge thing. So yeah, I mean, they're all suffering from a lot of the same things, and it all comes down to one thing: how do you want to age? Right? We're either going to age very well, or we're going to age very, very poorly. And there's a lot of factors, your diet, your exercise activity, your lifestyle. And this is just another tool that a very effective tool, one of the most effective tools, if not the most effective tool that I've ever seen in all my years of practice. So it just fits right into what we're already doing with people.
So exciting. And I love that, you've been in practice for decades now, and you've seen people from all walks of life. So talk to me, from a movement and tissue perspective, talk to me about, how people are moving and how does this help?
So first off, I mean, if they're your average weekend warrior, CrossFit, high rocks, which is really really popular right now, or just your triathletes, or if the activity level, the carnosine which is the active ingredient in the Lactigo, the carnosine basically carnosine buffers lactic acid. That's how carnosine works. That's what the main function is. And so carnosine, anytime there's repetitive, intense exercise, our body pumps out hydrogen ions that lowers the pH or the acidity of the muscles, and that's what you feel as the burn. And so whether it's activity, or injury or an itis, like an inflammatory process, inflamed tissue or painful tissue is acidic in nature. So it doesn't matter if it's from, the breakdown of the muscle tissue from the exercise or if it's from the injury, the tissue is the same. It's acidic. So the environment is acidic. So the carnosine will buffer that pH and actually not allow it to drop. And so it's an intracellular buffer, and it's been shown in studies and in live practice, in labs, through muscle biopsies. I mean, but it's just that's the function of carnosine. So carnosine, though, like the problem is, and this is what I get all the time, and I'm sure you get it, is if this is so great, if Lactigo is so great, how come I've never heard about it? I got that twice today
Mhm.
in clinic, and because we've never had the easy
Great
answer is
question.
we've never had
Mhm.
the technology. We've never had the
Mhm.
as tech, and just as we went from bag phones in your car to flip phones to now a computer, handheld computer in your hand. um, Technology is advancing
Mhm.
at a rapid pace, and whether it's in clinic, whether it's in medicine and healthcare, or whether it's in like computers or aerospace engineering, I mean it's moving at a rapid pace. So that is the main reason, is it because we've never had it available and now we do.
I love how you frame that. And as we look at this, I always want to be on the cutting edge of medical technology, innovation, and it's come so far. And when it comes so far in an effort to help people, that's where the magic happens, right? And so, a couple of the resources that I love to share with those tuning in: PubMed.gov, the public medical government website where all research is housed in National Institutes of Health. It's a great place to go and see the trajectory of how carnosine and the research on carnosine has increased and improved over time.
Mhm.
And now, Dr. Willie, let's jump into one of the biggest questions that you and I always get, and
Mhm.
especially you being in practice every single day. People are already taking supplements. They're already taking all these supplements and all of these things, trying to be healthy,
Mhm.
and do the right things. Why is that not enough? And what are we seeing?
Well, simply because we're getting older, we age,
Mhm.
and aging is inevitable. I said this at the conference this weekend. Aging is inevitable, but decline is not. Okay,
Mhm.
we have so much technology now to not age with the typical course of aging in our culture, which is just this like steady decline. We don't have to just kind of stoically accept that we're just gonna not be able to move properly.
Mhm.
But basically, we're all gonna face aging, and that's primarily because as we get older, we have less mitochondria. We can get into the weeds real quick about cellular health and all that, but it comes out down to the older we get, the less mitochondria we have. The less mitochondria we have, the less ATP we produce. The less ATP we have, the less energy we have. So that's primarily, and then everything starts to break down. Our body doesn't repair the same. Our proteins start misfolding. Our immune system goes down. I mean, so it all comes down to still like mitochondrial health. And then there's a lot of things in our daily life, in our lifestyle, that are kind of challenging that, right? So our standard American diet, I told patient this morning, it's like, if you want to eat healthy, I mean, go to another country. I mean, without thinking. Like, if you want to eat healthy without thinking, you need to go to another country. But
Mhm.
in the United States right now, we have to be intentional about our diet, about our lifestyle, about what we're putting in our bodies. And the easy answer with, why Lactigo is so easy to integrate is because it's not another lotion, pill, potion. It's a topical, and it's
Mhm.
it's not invasive. It's not another injection. It's not another, hormone medication, anything we need. And again, it's not taking the place of anything. It's a supplement, right? So there are some other very important things that we need to take care of foundationally, right, from our hormones to everything else as we get older. But the carnosine just fits right in to replenishing what we lost. So that's an important key factor, is that carnosine is something that we had a lot of when we were young and that we don't have as we get older. So
Mhm.
as we age, it drops off. And there's never been a good way to replenish it now until now.
Mm-hmm.
Because orals didn't work. Anytime that you hear about carnosine working, it was generally injected, infused IV. There were other, because it's not effective taken in orally, which is why the Lactigo with the carnosine works so well.
Right. Now, Dr. Willie, I have
Hmm.
3 little toddlers, and I truly believe that they are so overloaded with carnosine because, they're like Gumby. Kids are
Hmm.
so malleable when they're little.
Hmm.
They can fall and go boom right back up.
Hmm.
I fall and I'm like hurt for days, right?
Hmm.
So, talk to us from a functional medicine perspective because, this is where people think they're doing the right thing. And most of us are trying our absolute best to be healthy and fit and at the top of our game. But from a functional medicine perspective, you talked about this a little bit, but tell us truly, like, where do things start to break down and how does carnosine fill in those gaps?
So things like start to break down really, starting after age 20, we start to drop, carnosine, like right after 20. So to your point, you have never ever heard of a 10-year-old coming to you saying he's sore, right? They can run, drop. I mean, I saw my granddaughter like jump down on her knees and jump up and land on her knees, and that would have killed, like, you and I would have been debilitated for days. And yeah, so things just start to break down immediate. And like I tell people, your metabolic health and all the other things in your health, it's not all of a sudden I'm 40
Mhm.
and all of a sudden I got diabetes or pre-diabetes. All of a sudden I got high blood. It started back in your teens and 20s.
Mhm.
It's cumulative. So from a foundational standpoint, I mean, we start to drop off at 20 from a carnosine perspective. We start to, if we're talking strictly about carnosine, carnosine, like, I mean, it peaks maybe in our teens to 20s and then starts to drop.
Mhm.
That's why, like, look at professional athletes. When do they hit their peak? Their peak is,
Mhm.
maybe their peak performance is going to be 25,
Yep.
25 to 30. But that's also because not only does carnosine drop off, but tissues start to degrade. Our bodies don't recover and repair as well. So the carnosine just fits in as far as you know giving us something that we need, that we used to have, that we don't
Mhm.
have. So
I love that. And it's so simple, right?
simple.
It's so simple. So let's talk about that because it's not just trying harder, it's not doing more things, it's not
Mhm.
adding more to your life. It's keeping it simple and effective. And I
Mhm.
love the efficacy factor of
Mhm.
what we're learning about carnosine specifically and how it shows up in the body for people that have lingering soreness, want longer recovery, that want faster performance, or just
Mhm.
to wake up and feel like they weren't beat up overnight, right?
Yep.
So talk to us about that. Like, how does it show up in the body? How do people apply it? What should we look for? Give us what you do, and what you share with your patients in practice.
So plain and simple, we just tell them minimum twice daily. So, we have cards that I give them, and it just basically says, frequency, right? And it just says
Mhm.
AM, PM, morning, night, or before and after activity with no upper limit. If they have an acute injury, some kind of inflammatory, like some kind of acute, you know, condylite, like, like a golfer's elbow or tennis elbow, or some type of like shoulder inflammation process, we tell them 3 times a day. The sweet spot's really been 3 times a day, just so it keeps a high level of carnosine. So
Mhm.
if there's something acute going on, some kind of acute pain, any kind of tendonitis, any kind, like I said, any itis, 3 times a day until they feel better, and then maintenance is about twice daily. We don't have to worry about putting it on too much because there is no upper limit. You cannot overdose on the carnosine. And you cannot dose. I got this question a lot this week, and you cannot overdose on the magnesium because it's not the oral. It's not gonna hit that oral
Mhm.
GI limit where, because it's a magnesium sulfate, which is more like it's what's in Epsom salt baths. But it's also not taken in GI, so it's not going to cause a GI disturbance that too much magnesium can cause if anybody's ever had that.
Mhm.
So,
Perfect. And, so those of you tuning in, 2 times a day minimum. I know for us in our household, everyone from our 1-year-old up to my husband, everybody uses it a minimum
mhm,
of twice daily.
mhm,
And not just for lingering issues, but it's more for
mhm.
overall health. And
Yes,
we're
you
learning
just
so much to the
yeah.
point where, like, Dr. Willie, after this event, and after talking with you, every single time I hear you talk, I just want to jump into a bathtub full of
Uh,
lactigo
yeah.
and like rub it on my eyeballs to, to my toes. So, I absolutely love, as always, you guys tuning in. This is not medical advice. This
Mhm,
is not, but this is just tips and tools for you to perform, and do your best, right? So, Dr. Willie, you've had years of experience, decades of experience. So, working with people, seeing patterns, watching how people, recover. So, like, let's dive into this. Why does recovery matter so much after 50?
Well, like I tell people, it's like training is digging a hole.
Mm-hmm.
Recovery is filling that hole back in. What we generally do is we dig, we train, exercise, and nobody fills that hole back in, adequately, right? So that's going to
Mm-hmm.
come, filling that hole back in means your diet, your nutrition, your recovery, your supplementation, your massage therapy, whatever you want, your foam rolling, whatever you want to do, right? And so what ends up happening is if you dig too deep of a hole and you don't fill that in and recover well, you end up breaking down. You end up getting an overuse injury, right? You end up getting some kind of tendonitis, and then that knocks you out for a week, 2 weeks, and then training is sidelined, right? So over 50, we just don't have as the ability to recover as well as we did when we were teens to 20s. So you do have to be more intentional about that. Now, um, what this has done is this has made it so much easier to get back into the gym the next day because you don't have the sore. I can tell you from a personal standpoint, I am nowhere near as sore. And I'm sure just like you, I wish that I had this 10 years ago when I was, training for the CrossFit games and doing other things. And because it was a job. I mean, it was
Mm-hmm.
making sure that I got a massage a couple of times a week and making sure I went to a soft tissue specialist and doing grass and
Mm-hmm.
ART and all the things that you needed and taping and now I find myself training and not feeling that excessive soreness where you
Mm-hmm.
can't, you have the baby legs walking down a
Yeah.
ramp or walking downstairs. I don't get any of that. And so it's easier to train. You don't not train the next day because you feel like you need an extra rest day. Your activity level increases. Um, and simple things like for myself and again, this isn't medical advice at all. I'm just explaining what we're seeing in the clinic, what I'm seeing with myself, right? So I had an issue with what's called decurvane's tenosynovitis. It's a really bad it's a really bad um, kind of inflammation of the tendons. There's two tendons in the thumb that get really inflamed. I mean, and it'll prevent you from sleeping at night. You'll have to wear a brace, like an actual brace that isolates your thumb, or you can't sleep at night. And in the past, the only way to really fix that is an injection, like a steroid injection, and that's what I had to do in the past. I got it again a few months ago, rubbed the Lactigo on it for like 2 days, and it was gone. No steroid injection and things like that. And I was like, it's already thinking to myself, man, I'm gonna have to give myself another injection or get another steroid
Right.
injection. But that's what we're seeing, and it's actually really, really, really quick. So any of the the recovery that we're seeing, the stories just keep on piling on about, I'd put it on and, at 5 minutes, my back pain was gone, or 10 minutes, my back pain was gone. Now, again, I urge everybody that if there's a structural issue, right? If you have an ACL tear, if you have a rotator cuff tear, it's not going to magically, and nothing is, right? Nothing is going to magically heal that rotator cuff tear, but the pain and the inflammation that you're having that allow you to get along with your day is what significantly improved. And then the typical inflammatory itises that we get are just like massively like downgraded quickly.
I think
So
that's one of the things we love so much. And thank you so much for sharing that and really honing in on why this matters so much for those of us, who are aging and want to age gracefully, because we all are going to age, right? And so this is an amazing tool to add to your toolkit.
mhm,
And yes, Dr. Willie, I think back to the days when I was competing as a pro in marathon and triathlon. I'm like, where was this magic
mhm,
gel when
mhm.
how much better could I have
Yeah,
been, right?
yeah,
But
yeah,
thank goodness our children and their
yeah.
children will get it.
Mhm,
And so that's the beauty of technology and innovation. So share this
yeah.
with everyone and
Mhm,
just try it. That is what I'm getting from and what I'm hearing from you is just try it
mhm.
and keep trying it. So before we wrap up, Dr. Willie, what is one thing you are most excited about moving forward? What is the one thing that lights you up?
Just hearing all of the like from this weekend, I mean, there were lines of people. Like I would look up and there were lines of people that would kept coming up just wanting to let us know what it has done for them. And we're still finding applications for it, things that we hadn't even thought of that that we're still learning what are all the benefits of carnosine like to the body. I mean, I had
Mhm.
stories from I, you know, I stories about TMJ and stories about neuropathies I'm seeing in the clinic. I'm seeing a lot of
Mhm.
neuropathies. I'm seeing a lot of patients actually being able to stop their gabapentin. Which, if you've been watching gabapentin in the news, a lot of the data has come out on how bad gabapentin is for cognitive function and a lot of other issues. And gabapentin is just not really a great drug and is actually pretty harmful. But for nerve pain and other things, it's kind of one of the only things in our toolbox. I don't personally prescribe it. I don't. I'm not a big fan of it. But patients that have been coming in with neuropathies and other kind of nerve pain have been getting really good results from it. But yeah, what excites me is where this is going in the next year and what are all the new things that we're going to see and applications that we can use it for, and then the stories, what stories are we going to get back? Like we
Mhm.
had, I mean, I wish I could share all of them, but we had so many incredible stories this weekend about of people, of their results that they had with Lactigo, and I wish I could like elaborate on some of them, but I don't want to take it into a non-compliant you know uh arena. But it works. I mean, again, in all my years of practice, I've never seen anything that works this quickly and works this well,
Mhm.
and non-invasively.
Yeah.
I don't have to worry about what medication a patient is on, if there's a medical interaction, if they have a contraindication, how old, how young they are. I mean, I have baseball kids that are travel ball kids, volleyball travel kids, volleyball club, all the way up to elderly, using it. So
I think
everybody
that's
benefits.
yes. Thank you for sharing what you're most excited about because it gets me fired up. When we see just, people are mind blown when you're like, it's not going to stress your digestive system.
Mhm,
It's not,
mhm,
you apply it topically and it goes directly into the muscle and then
mhm,
it's a healing agent. So it
mhm,
goes to where the inflammation is. It
mhm.
finds the point of inflammation and it's a healing agent. It's going to
Yeah,
help heal you.
yeah.
You can't overuse it. You can't overdose it.
No
It's
side
just
effects, no gut issues, no, I don't have to worry about it at all. And the worst thing that it could do is maybe not work completely. I will tell you in all honesty, I have yet to see it not work. Now, in some people it works way quicker and way faster and way
Mhm.
better. But there's a lot of variables. What other like variables do they have? Or what other things are compromising their health, and
Mhm.
is it a structural issue? But I have yet to this day, in over a year of using it in clinic, uh, seen anybody that not has not come back. And in fact, it's the opposite. The majority of people are saying, 10 minutes after I put it on, my back pain was, or 10 minutes after I put it on, my elbow stopped hurting.
Mhm.
And headaches. I had a massive tension headache the other day. Just where, just the back of your neck is just throbbing. And within 5 minutes, gone.
Mhm.
Like usually I'd have to take some Advil and some other things, which, I don't like doing.
Mhm.
Didn't have to do that. So yeah.
It's such a beautiful product. It's such a blessing. And I could not be more grateful it fell into our lap. And those of you tuning in, I'm seeing a lot of people typing in how it's helped them. We want to hear how it's helped you. If you're watching the recording, how has it helped you? And if you think of someone who you're like, oh my goodness, I need to share this with somebody, share it with them. And,
Mhm.
just try it. We have an amazing company, an amazing team. Reach out to someone, just try it, get started today. And yes,
Actually,
it
actually,
doesn't seem
one last
bad.
thing,
That's one of the
Jess.
cool things. Yes, over to you, Dr. Willie. Yep,
One
and then
last
we'll wrap
thing.
up.
The I'm excited about the velocity, like for the stories that we heard from the equine
Mhm,
vets, and
mhm.
the new product called Velocity that's coming out for the horses. That's going to be amazing, and also for vets. There are a ton of people that they love their, my dogs are outside barking. We love our animals, we love our pets. And one of the things that we hate to see is, as they get older, that decline where they can barely walk, where they used to run and things like that. And so I'm excited to see, them not be in as much pain and things like that from using it, from using the Velocity, the new
Well,
product.
you just brought home a really great point. In the future, one of our next Carnosine labs, we are going to be honing in on the animal aspect. Our new product coming out, sky's the limit, right? And our new product coming out is geared for your loved pets. So horses, dogs, cats. So we will be doing another Carnosine Lab on our veterinary side. So be following us on the Carnosine Lab. Please follow us on YouTube and Facebook, the Carnosine Lab. We post weekly updates, and every single Tuesday at 7 p.m. Mountain Time, we will be live with either Dr. Willie or an amazing practitioner or a Carnosine Conversation. So next week, we have health and wellness professionals sharing the incredible results they're seeing with their patients in practice. So you don't want to miss this. Also, right now, if you go to the person that shared this with you, or if you are already a brand partner, there are 150 milliliter tubes right now, limited time offer for the 100 milliliter price point. That is not going to last very much longer. Plus, you also get 3 on the go packs, as well in locked in pricing for this month only. So 10 more days to get this incredible limited time offer. And there's a risk-free guarantee. You guys just try it. If you like it, if you don't love it, we will refund you completely. So it is risk-free. So just try it. And thank you so much for supporting us, Dr. Willie. Thank you so much for being on, for sharing your time, your heart, your wisdom, and your expertise. It is always an honor to work with you and hear from you and have you on these Carnosine Conversations. And thank you, all of our viewers from YouTube, Facebook, Instagram, all of you tuning in across the world and around the country. And finally, you guys, I could not be more excited about the future that's ahead of us with the Carnosine Lab. So thank you again for tuning in tonight, and we'll see you again next week. Bye for now.